Hello, my name's Ian McCall, and this is a video on Clods from the Dermoscopy Made Simple blog. Let's have a look at Clods. Clods are fairly uniform in colour. They can vary quite considerably in size. They're bigger than dots. They can vary in shape as well. They're not necessarily round. And in my opinion, their colour is the best differentiating feature. I want you just to note two things: the white and orange clods of seborrheic keratoses and the blue clods of BCC and melanoma. This little table here has the different colors. The red and the purple ones are usually associated with hemangiomas. Sometimes they're actually black in some hemangiomas where you've got thrombosed vessels. We'll show some examples of this in a minute. Note the yellow and white clods of Sep-Ks, but white clods can also be seen, and the other name for white clods is milia, can also be seen in congenital nevi, sometimes in BCCs, very rarely in melanoma. The more rare something is, the more we have it out in this end of the table. And the blue ones, the BCCs and the melanomas. Let's go and have a little look at some different colors of clods. Okay, these are the white clods that you're going to see in some seborrheic keratoses. They're milia. They vary in size. I think they've been described as a starry sky if you're looking at them. They represent retained keratin within the epidermis. Remember, polarized dermatoscopes may miss these a bit because they tend to miss the top layers of the epidermis and see a bit deeper. So the white clods normally of seborrheic keratoses, but also in congenital nevi, sometimes even in BCCs, and very rarely in melanoma. What about these red and purple clods that we were talking about? Let's have a look at this. This is a partially thrombosed hemangioma. It was partially compressible. This is the clinical here. You can almost see the various features that you're going to see up here in the dermatoscopic view. There's a black clod, which was thrombosed vessels. There's some purple ones. There's almost a blue clod there too, but it's more blue-purple than blue. These are almost red clods. This is the non-thrombosed part of this hemangioma. You got the white structureless area in here that's a bit of scarring within the lesion. So, purple, black, red features that you'll see in some hemangiomas, and some of them can look bluish as well. I know we've said blue clods mainly BCCs and melanoma, but you've got to include, I think, hemangioma in there as well. Now, let's look then at these blue clods. We've said BCC, melanoma, perhaps hemangioma. Look at this one here. There's the clinical. It's a little bit vague there. You get a hint that there's some color in the center of this. Then when you put your dermatoscope on it, you've got this blue clod here, but you've got a little white, some white clods here that, as I said, you can see in BCCs, but look at these serpiginous or arborizing branched vessels, very, very typical of basal cell skin cancer. So this is a pigmented BCC with the blue clod. What about this one? Here's another blue clod, deeper in color. This was the clinical here. Now, as well as the blue clod, you've got some pigment round about this. And when you have a look here, what have you got? As well as having a blue clod, you've got lines reticular. Now, you're not going to get lines reticular. Let's see if we can make that just a touch bigger. There we go. That'll do. There you've got your lines reticular in this, and you've got some lines reticular down here as well. So this you wouldn't get in a BCC. So this, in fact, was an invasive melanoma. So let's go back to our table again. said blue for BCC melanoma. I should put hemangioma in there as well. The black we saw with the thrombosed hemangiomas. You get black with clots with old hemorrhage as well. Sometimes on the soles of the feet with the talon noir. We've talked about white, yellow, and orange ones in SEB-K. You can get some orange ones even in BCC. I'll need to try and show you that. But what I want to look now at are some of the brown clods. And I've got congenital nevi spits, a growing nevus, where normally your brown clods are often around the outside of the growing lesion. SEB-K and rarely melanoma. Let's have a little look. Okay, I think we'll make this just a touch smaller again. Okay, back down to size. Here you've got a variety of brown clods, varying sizes, and mostly one color. This is more structureless rather than brown clods. This was the clinical here, and this is the picture that you'll see in a congenital nevus. They used to describe, if these are closely packed together, they sometimes describe this as cobblestoning, but in Kittlerian terminology we don't really want to use these metaphorical terms. So brown clods grouped closely together. Congenital nevus. What about this one though? Again, brown to black clods, lots of them. No real lines reticular within this, and it was an unusual shaped clinical lesion. But in point of fact, this was a seborrheic keratosis. So brown clods can be seen in the seborrheic keratosis as well. This one could easily be mistaken for a melanoma. But as I say, no lines reticular in the background of this. And lastly, here's another lesion. It's rather lonely here, and I think it had been thought to be a seborrheic keratosis. But when you look at it, you've got some brown clods here, but you've got thickened lines reticular down here as well. And that tends to count a bit against a seborrheic keratosis. Doesn't completely exclude it. But up here, you've got some red clods with a little adjacent hemangioma. Point of fact, though, this was an invasive melanoma. So you'll get some brown clods in melanomas as well, but if you've got thickened lines reticular like this, it certainly should point you towards melanoma as your diagnosis and away from any seborrheic keratosis. So that's just a quick overview of clods. Remember the different colors, certainly the blue clods of BCC melanoma and some hemangiomas. And I hope you've enjoyed this. Bye-bye.